I'm Marlynn Riker. I'm a licensed clinical social worker. I've been working in the field for almost 30 years. I'm trained in EMDR, which is eye movement desensitization and reprocessing. It's a very powerful tool that can help move trauma in people. Trauma can be very debilitating for individuals, causing all kinds of different symptoms: depression, anxiety, irritability. Trauma also stores in the body. It can cause diabetes. Sometimes chronic pain can be related to trauma. So it's a powerful tool to help move that trauma out so an individual can heal themselves. How it works, I'll give you just kind of a brief run through of how it works. We use bilateral stimulation. What happens with trauma is over and over again, the brain gets sort of dinged and the cortisones come out, which creates all the other irritability, and it gets stuck there. It gets stuck in the memory cells. And our memory cells are kind of like a jellyfish. So when we start the EMDR process, we're trying to clean out these fingers and move this trauma. We want to move the trauma out, move it to the frontal lobe where it can be processed. So when that occurs, then the individual is no longer triggered. That's PTSD, post-traumatic stress disorder. They don't forget what happened, but they're not triggered. And how that works is pretty complicated. But basically, it's based on bilateral stimulation. So I have this nice little machine here that will help folks gently feel both sides, which triggers both sides of the brain. And then there's a script I take folks into, and I work with their feelings, what's going on, where they're at. I have them bring up the incident and we go through it. Now, you can't necessarily just have someone come in the office and start EMDR. The individual has to be taught how to breathe. They have to make sure they have good affect regulation. They need to develop the allies. And this will make sense when an individual comes in. And because what happens is the individual goes, visualizes the event. And what they're doing is they're sitting in a movie theater and they're watching what happened to them on the screen so they can process it. So the feelings can come up and they can endure them, and that's part of the healing. But there's a lot of prep before you start EMDR. And when an individual goes through EMDR, in fact, I had a lady today did tremendous work. Afterwards, though, you're just drained, because that's a lot of processing and a lot of emotion coming out of the body. It's very powerful. I've never had anybody have a bad reaction from going through this process. Most of the individuals have said it was incredibly healing for them. I have one lady that was very skeptical, and she was amazed. It really did help her. I've had some people start and say, no, this is not for me, and that's fine. And it's a very safe place. Even though you go into that place you don't want to be, I'm there with you, and I bring you out and ground you. So it's a whole process. It's wonderful healing. It's a wonderful tool for dealing with trauma.